Hello, my name is Simiran Choudhary, and I welcome you all on behalf of Voice of Healthcare to one of a kind and exclusive interview where we are constantly creating awareness on important health issues. And today, where we are going to discuss about stroke, its signs and symptoms, and its prevention with Dr. Arvind Sharma, Secretary of ISA, Board of Director of World Stroke Organization, Executive Member of Indian Academy Neurology, Director of Brain Heart Foundation, Ahmedabad, and Vice President of Neurosonology. Welcome to our show, sir.
Namaste. Thank you, Simran. Thank you very much.
Sir, thank you so much for coming to our platform. It's great to have you. And we all know that how ISA is immensely working on stroke awareness in India because it's very crucial and at this point of time the need of our to educate our country to make this a priority and to let them know that healthcare is priority for all. Along with Indian Stroke Association, Voice of Healthcare have also previously collaborated together to raise awareness about stroke in India. So we know that how important it is to educate our public about stroke, right? We know what the how important to create awareness, like to let them know what is the signs and symptoms, how we can prevent it, and most importantly, the golden hour care where a person gets stroke. That initial 2 to 3 hours is very crucial. That can control the damage and can take a life also. So I want to know if you can tell our audience that exactly is stroke and you can outline some common symptoms of stroke.
Uh, Simran, thank you very much, first of all, to Voice of Healthcare to put up this interview for Indian Stroke Association. Indian Stroke Association is a 22-year-old organization, all together started in 2002. And we believe in this stroke awareness and the topic we have kept policy roadmap. But answer your first question, what stroke is, right? So it is a very important question because still people think that stroke happen in different organ, but stroke it happens to the brain. It is a brain attack. So the stroke as a definition is that it happens two ways. There can be an interruption of the blood supply to the brain, that is a clot, that is known as an ischemic stroke. They are 85% of the cases. And the second type of stroke is when there is a rupture of the vessel because of the high blood pressure or any other causes. That is known as the hemorrhagic stroke, which are 15% of the causes. So brain, you know that there is a right and left side of the brain, and it is connected by a corpus callosum. So right side of the brain affect causes the symptoms on the left side. And we all know that right side of brain is artistic for different of artistic things, right? And the left side brain is more for language. It depends on the dominance also, which right and left. So before telling the symptoms, I'm letting you know that if the right side of the brain affected, what are the symptoms, and left side of the brain. So the symptoms which are being told to the audience, as there are many who are not doctors and the laymen, I will put it like a very common layman form that is known as B.E.F.A.S.T. It is a lakwa. It is a paralysis. In that B is the balance. Whenever in your life suddenly you lose a balance, it is sudden word is very important. So if your balance is off, you should go immediately to the hospital to rule out stroke. E is the eye. If the vision loss is there of a single eye, sudden onset, that is important. F is the face. If you have deviation of your face and you are not able to move your face rightly and one side is deviated. A is arm and leg weakness. Slight weakness also is very important. Why you will get weak on one side, that is A. S is for speech. You are not able to communicate. You are not able to tell people what you want to say. Not only slurring of the speech, it is also important that you are not able to convey. That is known in our language aphasia. You are not able to communicate at that time. You are not able to speak the word. And T is most important. That is time. Time is brain. So you have to call for the emergency. So I will complete with this B.E.F.A.S.T, which is very important. There are other symptoms also, like if you become unconscious, if you're having a vertigo. A lot of people for vertigo, ki chakkar aa raha hai, sudden onset hua. But they think it is because of the ear, they go to the ENT surgeon. But 25% of the patient, because of the small brain behind, chota magaj, which we call by Nana Patekar, right? It is very important that chota magaj can cause imbalance, vertigo, unconsciousness. These are the symptoms which I want to let the audience know about. Thank you, Simiran.
Thank you so much, Dr. Sharma, that you have explained this in a very layman language so that our audience can connect to it and can understand like what if your right side of brain is affected, if the left is affected, and how it will the symptoms will vary. But and if a person gets stroke, what is the immediate practice or the step that should be taken, right? And at that point of time, the individual can take, and even if before that thing, if you have to prevent stroke for in their daily lives, what are the habits that they need to follow?
So, how to prevent a stroke is a lifestyle thing. Very rightly said by you that a stroke is a non-communicable disease. Just like
Yes.
heart attack, just like obesity, any other non-communicable disease which are because of the lifestyle, that is stroke is also like. It is a vascular risk factor. Like heart, it is also a vascular supply. 20 to 25% of the blood from the heart, when it pumps, it goes to the brain. So it is a major supply of the heart to the
Hmm.
brain. So if that is interrupted, why it is interrupted? The same thing. Like you should not, first of all, have a sedentary lifestyle. Not at the age of a 50 or 60, right from the beginning. Not at the age you think now I'm 50, so I should start working out now I'm having a blood pressure. So I'll give you an example that when you do exercise right from the beginning, you develop good collaterals. So when your major supply is gone, as you see the wires, right, the side supply is there to support you not to have a major stroke. So that we
Hmm.
call as collaterals. So collaterals develop when you do exercise right from beginning, not when you get a hypertension or diabetes, then you start exercising and do the things. So it is a lifestyle thing that you right from birth. When you study the sports, the activity, active life is also very important. So the saying खेलोगे कूदोगे बनोगे नवाब, right? नहीं पढ़ोगे लिखोगे बनोगे नवाब, right? But Prime Minister has said long back when he was Chief Minister, I think, पढ़ोगे लिखोगे बनोगे नवाब, खेलोगे कूदोगे बनोगे लाजवाब. Right?
Yes.
So that is very important, right? To develop those collaterals. So hypertension, to prevent hypertension, hypertension is the one of the most common cause for stroke, right? One, two, three, four, five. Even I ask you, if I ask the audience there who are listening, what is their blood pressure, like 25 years, 20 years, they will not know their blood pressure. So know your blood pressure should be a campaign across India for the young people, because I see 25-year-old, we all as a stroke neurologist see 25-year-old, 30-year-old coming to the hospital as a stroke because they were having a blood pressure of 200 by 120. It's a silent
Hmm.
killer. So blood pressure is the most common cause for the stroke. Second, diabetes. You have to prevent that. And how you can prevent that? With good lifestyle, like good exercising, good food habits in the form of vegetables and things. Don't take processed food. Don't take, everything is important in the food, but not to be excess of anything. That is very important. And smoking. Smoking, we see a lot of young patients coming to the hospital with stroke. Smoking is one of the major, and as you quit, people say, once I have started of smoking, I will have stroke. It is not like this. Once you quit smoking, 5 years, you are at the baseline to the other smokers. So your risk becomes 15% decrease as you stop quit smoking. So these are the very important risk factors which you can prevent stroke. But if you stroke happens, you have to reach to the hospital. Don't go to your general physician or to your physician. Go straight to the hospital where the CT scan is there at least, because CT scan is equal to ECG of myocardial infarction MI. It is equivalent to that. Go to the stroke ready hospital straight. Thank you.
That's great. So, and that's how I believe a normal general public, they are not aware of what is happening to their body. So generally they rush to their general physician, and that's how they lose the time. So it's always better to be aware about what is happening to your body and to take actions accordingly. And more than that, it is always better to take preventions, like you said, खेलोगे कूदोगे पढ़ोगे तो बनोगे लाजवाब. So it's always better to make a regular daily exercise a part of your life. Without that, your day is incomplete. So that you can prevent all such things which in which you need to hurry or think, okay, what to do now and stuff like that. So that is a very great part of lifestyle that you just added, and that is in control of our hands.
Absolutely. Very rightly said, Simran.
And so, like we all know, that ISA is doing great work and immensely working for stroke awareness. So, I want to know few of the key initiatives that ISA is undertaking under your leadership to combat the burden of stroke in the country.
Uh, Thank you for that question. Indian Stroke Association, not from now, from last 22 years, has been separated from the main organization, the Indian Academy of Neurology. Some of the stroke neurologists, they thought we should have a stroke association. Now we are altogether more than 1,200 members, and this organization has done a lot for their peers as a stroke neurologist to develop stroke in this India. And I tell you, the stroke program which has developed across India, we have a lot to do, we agree. But if you see with the West, we are par equivalent in the form of doing all the latest procedures which are done in the West and within the time window which we are doing. But still, as we are more than 1.2 billion population, there is a lot to be done for stroke in India. So Indian Stroke Association has taken few initiatives which are very important in the form of the we have a World Stroke Day on 29th October, right? And last year only we started a program with B.E.F.A.S.T, and we did the wonderful government policies to bring the government people together, to make the policy people together, to get the ICMR people together, the national mission people together. And it was a huge amalgam of the different part where the stroke can be taken to the public and what strategies to be taken to address those awareness to the public. So World Stroke Day, World Stroke Month, creating awareness. So it is not only to the doctors, but it is important to the paramedical staff like the physiotherapists, the nurses. We did a nurses program, we did a physiotherapist program, because they are all part of stroke. Stroke acute treatment is one part, but when the paralysis happen, you want that people to be on his feet or using his hands, speaking after 3 months. So other paraclinical areas are also important for us, like physiotherapy, the nursing care which is happening in the hospital. We have to let them know how the swallowing test is done. These are very important. So Indian Stroke Association has taken multi-pronged approach to create awareness to the nurses across the district levels, the physiotherapists at different levels. And we did this program last year for doing all that, and looking forward to for such programs more. And subsequently, Indian Stroke Association has developed with Quality and Accreditation Institute a stroke accreditation program for primary stroke centers and advanced stroke centers. Advanced stroke centers are those where the CT angio and you can take out the clot by thrombectomy is available. And that is all the neurologists and stroke neurologists are available. But our main target with this stroke accreditation is to empower the physician and go to the primary stroke centers like community health centers and the primary health centers where the CT scan is available, as COVID has given us the blessing that CT scans are there even at the community health center and the primary health center. And if we empower the physician with the help of the neurologist, so that stroke accreditation program, national program, we have taken to the ministry also, and they told that it is a Atmanirbhar thing. And we are the third country, like USA, Canada, and India is the third country to develop this stroke accreditation program across India. So for the fellow people, another initiative which we took as a neurologist, those who want to do stroke. For me, if you see, long back, I went to Canada to learn stroke and subsequently come here. But Indian Stroke Association, all the people who got trained, why to go outside when so many people are mentored here? So we have applied to the National Board of Examination for the fellowship in stroke, and I think that will be an exam, and subsequently more and more stroke neurologists will develop in India, because there is a lot of dirt, a lot of gap between the doctor, nurses, and public, right? So that gap has to be filled, and B.E.F.A.S.T and a lot of other organizations going to help us reach to that public level.
Definitely, sir. That's why we all are collaborating. We are here to create awareness on important health issues, and one of is the stroke awareness. And we are together for this, in fight of this. And the great work you are doing to educating from the medical staff to medical experts to the public, through the various programs and awareness campaigns ISA is working on, that's great. Because the way we can start is by educating people. First, the medical staff, nurses, experts, and then to the public. And that's how the whole awareness will come in the society, right? What kind of steps to be taken, how it can be prevented, and especially the nurses, they need to understand, the medical experts should be trained in safe hands as an experts, that these are the things, the policies which has to be taken, that's how ISA is working, that's how the Indian standards work, right? And why to go out if we have all the facilities in our country itself?
Absolutely, very, very true. And that is what the Indian Stroke Association is all about, and that we empower our own colleagues to develop more practices which are uniform and standard across India. India is a big country, right? So you have to develop a national program for such things.
Yes, sir. India is a big and dynamic country, and that's how we all are growing together. India is in its growing stage, developing stage.
Absolutely.
So there is this one thing that we know, that like you just explained us also, that ISA is working on advocacy of stroke, right? So I want to know that in layman's terms, the advocacy work that ISA involved in to promote stroke awareness and prevention for public.
So, Simran, fantastic. That question is very important. From C, we have an organization where president, every time a president is elected, and they have a different vision, and different advocacies are done for the public awareness. This year, theme is a mission brain attack. So this year, what advocacy has been done with our president, I think you have interviewed him also, Dr. 𝗫𝗀𝗶𝗰𝗵, and he has given the vision of this year. And I think we started on the first note by training our physicians at Varanasi. And I think that is the place, we did it one day prior, where our Prime Minister has just nominated his for the Lok Sabha election. So it was a wonderful place to start our national program of Mission Brain Attack with our president. And this Mission Brain Attack is for the education of the physician, and subsequently having a patient support program, which we did. The patient were called and their relatives were called for understanding what difficulties they are facing and how we can improve. And it was a wonderful experience for us. There were a lot of questions by the patients and their relatives which were present at Varanasi. So one is all this Mission Brain Attack will be physician training on one day. The second day will be the patient support group, and the patient will be there for the public awareness. That is what and this will go, started in the Varanasi, will go to West. Aurangabad is the tentative place, then it will go to South, and then it will go to the East side. So this is how we'll try to cover all the zones to train the physicians. They know, but they want to do it, but they need some people to understand how they will do it. Because there are a lot of hiccups, because CT scan is needed, thrombolysis to be done. They have the facility, but they don't know how to formulate the stroke pathways. So we are doing the advocacy for developing this similar stroke pathway for the physicians, and simultaneously getting the patient and the support groups there to make them understand, having a press conference to have the city awareness about that stroke in that region.
Yes, sir. Like you mentioned, the vision of this term when we interviewed the president also. So this thing, he also mentioned that how Varanasi camp was been, and how you guys are training people out there, and picking some these kind of zones like north, east, west, and south. That's how people will get to know the importance of stroke, awareness about stroke, and medical experts, what kind of steps can be taken for that, and how to treat the patients, what kind of steps to be taken on the spot when a person comes with stroke. So I think ISA is doing a great work with this kind of campaign, educating public as well as medical staff, medical experts at the same time, and creating a great large impact and awareness on public. Congratulations on that, sir.
Thank you very much.
So, another congratulations for your second term as you have got reappointed as Secretary of Indian Stroke Association for
Thank
this
you.
time as well. So, I want to know your vision of this tenure. So, how is your this tenure different from your last tenure, and what will be the vision of this tenure?
Oh, thank you very much for the congratulations. And I think it's my fellow colleagues whose support is there. And I'm here with my family support and good friends. And thank you very much. And talking about the vision, last 3 years as a secretary for Indian Stroke Association and the president I worked with, like Dr. Anandalkar, Dr. 𝗤𝗫𝗏 and Dr. 𝗤𝗫𝗏 is at present it's a president-elect for the World Stroke Organization. So it is a beautiful moment to work with such legends. He's going to be president in this October, and we started formulating the stroke awareness videos at that time. We started getting in touch with the 𝗤𝘀𝗶𝗆 and all stroke support group at that time, and then subsequently Dr. 𝗦𝗫𝗶𝗆 came as a president, and we launched this stroke accreditation program with Quality and Accreditation Institute and developed the stroke fellowship program. And further, we developed a subsection, kind of a niche product for training the pediatric stroke, because there are a lot of stroke happening in the younger people, the child, the age of 15 or 16. So we developed a conference and deliberations for the National Pediatric Stroke Conference, which is done last year first under the leadership of Dr. Anandalkar. And this year, Dr. Vikram Reddy, who was with us in our executive committee, is doing in Bangalore on 29th and 30th June. That is the second program for National Pediatric Stroke Conference. We do a stroke summer school for our students who are under post-graduation, doing their DM programs and DNB programs in neurology, to train them and understand if they want to. They are at the place where they are branching out. Like neurology is like a general neurology. They want to go in epilepsy, they want to go in stroke, they want to go in movement disorder. So that is the time we nurture them by doing a stroke summer school, that which field they want to go in, and we try to convince them to get to us as become a stroke neurologist. So we try that, and this year I think we'll go with this mission Brain Attack. That is our main mission, and strengthen our more accreditation hospitals. We almost have more than 12 are accredited, and more of the advanced stroke center, 3 of the primary stroke center. So we'll strengthen our national accreditation program for stroke. So we develop a uniformity across India, right? So one nation, one stroke pathway. One nation, one election is going a lot these days. So one nation, one stroke pathway, I think is one which we'll go into. And one person teaches another person about the stroke. That is another mission. I call it one teaches 100%, right? If you are listening today, Simiran, you may also have learned, I also learned from you. So you can also tell 100 people about what you have learned about the symptoms, and don't wait. You go straight to the hospital where nearby. You are in Ahmedabad, you go to Ahmedabad, don't go to Delhi for stroke, right? So there are hospitals across India. So we are touch pointing every hospital and where the stroke is happening. So these are the initiatives like Teach One and Stroke Accreditation Program, Mission Attack for the public. This is all we are going to do this year, and hope we are successful.
And so with the kind of steps you are taking, the national accreditation of accrediting more and more stroke institutions, and that way, so people would have more access to going to those places, those who are standardized and uniform in the practice of what to do, when to do, and how to do what kind of things. So that way they would have more facilities, even if a person gets stroke, and they just need to have the awareness of it, and that's it, they can save the life.
Absolutely. Very
In
right.
that way, sir, I believe the second term is more, I believe, is backed up with power, great ideas, and it will have a great impact in the coming years of the tenure. And I believe we will see you soon for the third term as well, because we need more development and changes in for stroke awareness.
And thank you very much. Now, there is no third term, we have only a 2 term. We'll move further
Okay.
up in the ladder if God wishes.
Yes, sir, definitely. I believe there is no stop to going up. We just have to vision, and then we'll definitely reach to our heights.
Thank you, Simran.
So my last question, my last point will be, can you provide an overview of the current landscape of ISA and its role stroke awareness in prevention in India?
So the current landscape, if you see what the incidence is for stroke, 1.8 million people across India are suffering stroke, right? And out of that, every minute 3% are suffering stroke. And you see the case fatality rate for stroke, it is very high. And we are not even worried about the case fatality that has to be brought down, I agree. But the morbidity, the disability which happens for the stroke is very important to understand, because once a bread earner, it is not gender biased, male or a female. Those who are bread earners, if they get a stroke at a very young age because of the lifestyle like smoking, they don't know their blood pressure. So our landscape is at the prevention of stroke rather than the treatment. Treatment, I agree, we should provide the treatment, the best of which is going across the world, and we are doing it. There is a big gap. We have to increase the number of the hospitals where the stroke, hospitals are there, but where the stroke happens in the form of the advanced nature. And the primary stroke center also, patient need not to come from one of the villages to the main center just for the thrombolysis, which can be done by the physician. That is another. So I think we should develop a good preventive measures to let the people know about two objectives: quit smoking and know your blood pressure. And because we are the youngest nation, one of the youngest nation across the world, so these are the two parameters I want to tell the young people, that know your blood pressure and quit smoking. And enjoyment is in a different way. Enjoy life. There is a lot which is there you can enjoy.
Rightly said, sir. Prevention is the key where we can avoid these things, because ISA is doing great work in making some these kind of institute, national accredited institute. But that is the backup. What if we can prevent all these things? We would not need that. So ISA is doing creating a backup or treatment plans, but at the same time, you guys are working greatly in prevention, and you said it right. Uh, Monitor your blood pressure and quit smoking. We'll get rid of stroke and any other kind of health issues.
Thank you. I think there are some
So,
questions.
yes, sir,
Yeah.
we have some few questions from our audience. That is, one is, why is it important to get help fast after a stroke, and what help is there?
So let's say it again. Why it is important to get help fast after a stroke, and what help is there? So most, they see, stroke when happens, its supply is stopped to the brain. So as you waste time, the area which can be recovered after opening the artery will be dead. So that time window, 4.5 hours, is very important. So call
Mhm.
108 if you have that in that area. If you don't have a 108, call an ambulance and go to straight to the hospital where the CT scan is available. So they can give a clot buster drug to you where they can open up the artery and you can reverse the paralysis. So that is why the help to start fast is important. And the help is straight to the go to the hospital. If you can take in your vehicle, it is good. Or you call an ambulance and straight go to the hospital, which is stroke ready. This is by 𝗤𝘀𝗶ci𝗰𝗵𝗵. I think I answered
Yes.
that for the question.
Yeah. So next is, how my technology like video calls and smart computers help stroke patients. So our
Fan-
country is more of tech based. So this.
Fantastic, fantastic question, Rahul Kumar. This was a question of AI and stroke, and I tell you that we are moving towards that. That is what in the accreditation we have put. So the primary stroke center where physicians are treating stroke, they want to take help. They can use a AI software to send us the CT, and we say that you are okay to thrombolize that patient, and we are doing it. For I'm in Ahmedabad, I'm doing for Mehsana. There are where they want to, physician want to thrombolize. So that is how we are using technology for seeing the patient, but we are using the software. Even some proved like Himachal has done, because it's a hilly area, they have done by WhatsApp also, right? The one of the orthopedic surgeon has thrombolized one patient in, because the Himachal Pradesh chief minister was very aggressive, because it's a hilly area, people were not able to reach to the hospital. So this video call and computers, Rahul Kumarji is very important, and I congratulate you to bring this question on this show. So that is very much in the picture, and we are doing it, and we are more and more towards it.
So that's how we are coming up with the technologies and bringing it to our daily use. So next question is, what's hard about helping stroke patients in India, and how can we make it easier? It's by Vivek Chahar.
Yeah. So a very good question, Vivek, because it is very hard helping stroke patients in India because they are not aware about their symptoms. You know, if we have done one survey, 5,000 people coming to our hospital, and we asked them where stroke happens. You know, out of that, 3% even told lung, they have told kidney, they have not told brain. So don't have awareness about where stroke happens. They don't know about the symptoms of the stroke. So it is sometimes very hard. So if they have a weakness in the hand, तो मैं रात को गलत सो गया था, मैंने सही ढंग से हाथ को यूज नहीं किया, तो मेरा सुबह, एंड इवन डॉक्टर्स आर वेरी पॉजिटिव अबाउट इट कि थोड़ा सा हाथ वीक हुआ है, अभी 2-3 घंटे में ठीक हो जाएगा, right? So that is where it is very difficult and hard for the helping the patient if they don't know about it. Ignorance is sometimes a big threat for not able to treat those patients. And how we can make it easier? By creating this stroke advocacy, letting you as a medium to tell a lot of people whenever there is a stroke, where to go, when to go, and how fast you have to act. So these are the things which we should know, Vivek.
Yeah. So our next question is from Priyam Rajkumar. What advice would you give to someone worried about stroke because of their family history or other reasons?
Priyam Rajkumar, that was a very good question. You are getting those questions which we should have answered. So see, if your family history of stroke, see what we do in health checkup, Priyam and Simiran, what we do in health checkup, we all do below neck. We do echo of the heart, we do TMT of the heart is good, we can run, cardio, cardiac fitness, even smart watch is telling about heart fitness, but nobody thinks about the brain fitness. What about the brain health? So if you have a family history, simple test, don't go for any angio, do a carotid ultrasound, carotid Doppler and a transcranial Doppler. These are ultrasound where you'll know about your arteries are okay. So if there is something in the arteries there, you'll know. These are the prevention. These should be in health checkup. Above neck is also important. That is brain. Brain health is also important. So if you have a family history, you should know about it. You should know about the risk factors. Like your family has a young stroke, less than 55 years of age. See that there is a blood pressure in your family or diabetes in the family. What was the risk factor? Central obesity is the risk factor. Smoking. So see, genetic factors you cannot change. So then only modifiable factors you can bring in your life to change it. So that is only not the genetic factor. See, age, gender, genetics, you cannot change. I cannot get my hair back, right? So it depends. So you can change what can be modified, and we should do.
Yes, so that's great, and we got some great questions from our audience. This shows how concerned our audience is about their health and how importantly they take it. You know, the health is a great issue for them, and it's great we have this kind of people, the country in our country who are aware and concerned about their health.
Yes, very rightly said.
So it was a great session. We got so much of insights from you about stroke awareness, prevention, common symptoms, and the policy roadmap of what ISA is currently doing and the vision. And we got to know great things about the coming up campaigns that ISA will work on and how it will affect and develop our country in stroke awareness. And we are happy to be part of ISA in this initiative in terms of awareness and in any terms which we can help and collaborate together. Thank you so much for coming to our platform and sharing your insights and experience and answering to such great questions of our audience.
Thank you, Simran. Thank you, VOH, for getting me on board for this. And this will help a lot. I will finish with the lines that हारेगा stroke, जीतेगा India. Jai Hind.
Jai Hind, sir. That's great. Thanks a lot. Thank you.